Medical management of ectopic pregnancy. Ectopic pregnancy is an important cause of female morbidity and mortality, and early effective treatment is critical for the patient. An ectopic pregnancy truly is an obstetric emergency. It is crucial to determine the location and site and state of an ectopic pregnancy to be sure the right measures are taken. Successful resolution is necessary for the patient's safety. I chose to do some research on the medical management of ectopic pregnancy because I'm an ultrasound technologist and I have seen a few cases of ectopic pregnancy. Ultrasound plays an important role in identifying the location of the pregnancy as well as the presence of an ectopic pregnancy and whether or not it has begun to rupture. What I was interested in finding out is the medical intervention for ectopic pregnancy. I know methotrexate is a common medication used to resolve the ectopic pregnancy as well as surgical intervention. My PICO questions, P for the patient or population, is pregnant women in the first trimester. I for the intervention is methotrexate alone. C, the comparison, would be surgical intervention in addition to methotrexate. And O, which is the outcome, would be to reduce the maternal death from ectopic pregnancy. The questions that I posed are, number one, is methotrexate alone effective in resolving ectopic pregnancy? And number two, is it always necessary to both administer methotrexate and perform surgical intervention in order to adequately resolve an ectopic pregnancy? My literature search for the articles, I mainly used CINAHL and PubMed. I have had some experience with those in the past, and I remember finding great articles there. The subject headings that I used were ectopic pregnancy, rupture, management, ultrasound, and methotrexate. The search for me was a little frustrating because a lot of the really good articles that had a lot of information on ectopic pregnancies and treatment were from more than 5 years ago, dating back to the late 90s and early 2000s. Ectopic pregnancy is pretty common these days, so I believe a lot of the research was done maybe a decade or so ago, and it's a pretty common practice nowadays to treat an ectopic pregnancy and resolve those. So once I narrowed it down to the 5-year period, I was not finding many articles. So I used these subject headings simultaneously. Some of them I removed depending on the article I wanted to look for. Literature synthesis. It is critical to combine ultrasound findings with lab results and clinical presentation. Transvaginal sonography plays an important part in diagnosing pregnancy, and I truly realized that firsthand. Hughes stated that it is important to combine ultrasound findings not only with the lab results, but also the clinical presentation of the patient and the symptoms that they may or may not have. His article did truly highlight the varying presentations of ectopic pregnancy because a patient could present with having pain and bleeding, but could also have a negative pregnancy test. When having an ultrasound for that patient, there was an adnexal mass with an increase in free fluid in the pelvis. So correlating that with the vaginal bleeding, they took the patient right to surgery, and it did end up being an adnexal ectopic pregnancy. Junkman also stated that even though a C-section scar pregnancy is rare, it's probably 6% of ectopic pregnancies. Transvaginal sonography does play an important role in diagnosing that type of pregnancy. An early diagnosis of a C-section scar ectopic pregnancy can often just be treated with methotrexate alone. That should resolve the pregnancy. If the pregnancy and the C-section scar is not discovered until later in the pregnancy, then surgical intervention may be necessary. In the study that Ike performed, he found that methotrexate was successful in 55 out of 66 of his patients. And he also discovered that ultrasound-guided methotrexate injection was the most conservative form of treatment. Guiding the needle with the methotrexate directly into the pregnancy helped resolve that and avoid surgical intervention. Methotrexate is successful unless the ectopic pregnancy presents within the fallopian tube, which would encourage a salpingectomy, or if the pregnancy has ruptured, surgical intervention truly is necessary in that case. Vishma Soma and Lakshmadevi did state that in their case study, 100 out of 100 cases provided a definite diagnosis of ectopic pregnancies using ultrasound. Again, they correlated the diagnosis of the ultrasound with the clinical symptoms, which included amenorrhea, pelvic pain, and vaginal bleeding, which are the classic clinical symptoms of an ectopic pregnancy. They also stated that transvaginal sonography is the gold standard for diagnosing an ectopic pregnancy. They again noted that obstetric emergencies such as ectopic pregnancy are crucial to the patient's well-being. So using ultrasound for viability and site of the pregnancy helps to determine which form of resolution should be taken as far as using methotrexate or surgical intervention. Mergenthal did note that a single dose of methotrexate works best for patients with a low risk for a ruptured ectopic pregnancy. 2 doses or more without decreased levels of beta-HCG may need to lead to a surgical intervention. Practice or management recommendations. I don't really have any recommendations or changes that I would apply to the field that I'm in. I do believe, however, that it is crucial for ultrasound technologists to diagnose an ectopic pregnancy adequately in correlation with the radiologist. Taking appropriate images as well as correlating with the patient's clinical symptoms, their blood work is really important. Ultrasonography can be considered the gold standard in the diagnosis of ectopic pregnancy. And as Vishma said, it serves as the most non-invasive diagnostic test. Like I said, ultrasound technologists should always correlate the patient's clinical symptoms with their imaging. That way we can successfully diagnose an ectopic pregnancy if there is one present. And then radiologists can recommend a treatment path based on the site of the pregnancy. In conclusion, methotrexate is a successful intervention in resolving an ectopic pregnancy, of course based on the site of the pregnancy and in correlation with regular beta-HCG level checks. Surgical intervention is not always necessary afterward. If the methotrexate works, meaning that the beta-HCG levels are dropping drastically until they're negative, then that means there was successful resolution of the ectopic pregnancy. An ectopic pregnancy can always be potentially life-threatening, and a ruptured ectopic carries a higher risk of maternal death. A ruptured ectopic pregnancy needs immediate surgical intervention, and a tubal pregnancy will most likely result in a salpingectomy. And again, as always, correlation of ultrasound imaging and beta-HCG levels are crucial in diagnosing an ectopic pregnancy. If the methotrexate works, and the levels decrease and the pregnancy resolves, there is no need for surgical intervention. If the ectopic pregnancy is too far along and it's in the cervix or the C-section scar or an interstitial pregnancy, which is where the fallopian tube meets the myometrium, the uterus, oftentimes surgical intervention is needed to ensure patient safety. A few takeaways from this study. I did always know that ectopic pregnancy is a serious medical condition that needs to be immediately identified to ensure the patient's safety. However, I've not always taken into consideration that the patient may be asymptomatic. They may present with a negative pregnancy test and still have an ectopic pregnancy. So that being said, ultrasound is a crucial part of an ectopic pregnancy diagnosis. It's important to take all factors into consideration, whether positive or negative. Also, methotrexate or surgical intervention are the best options for resolving ectopic pregnancy based on the location of the pregnancy. And as always, saving the patient's life and maintaining their well-being is the most important thing. Here are the list of references that I've used for this study, and I hope you enjoyed it. Thank you.